Namaste, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Peeling skin syndrome, as the name tells, it's a condition where the skin starts visibly flaking off. See, we all have dead cells and these dead cells get renewed continuously. So there is production of the outer layer of the skin, there is shedding of the dead cells periodically. Why we don't see the dead cells going off? Because all these cells, they individually fall off. So that is why we are not able to see the peeling of our dead skin like in snakes. See, in snakes it is shed at a time and you see that peeling of skin visibly. Whereas in humans, the cells, they individually disintegrate and they fall off. The skin turnover time is around 4 to 6 weeks. So every 4 to 6 weeks once our skin gets rejuvenated. So whatever the cells which were there in the lower layer, it transports to the upper layer and it detaches itself from the skin without any visible flaking. However, in some conditions, these conditions are usually genetically occurring in genetically predisposed individuals, and here what happens is the cells are still very sticky to each other, and when they are flaking off, they don't disintegrate. So whenever they are not disintegrating, what happens is all these cells, they clump together and they shed together. So then we see the peeling of skin. You can't actually call it as a disease because that's the way the skin is actually shedding. However, that shedding may not look cosmetically good. So that is why this becomes a problem. In this condition, peeling skin syndrome, so either it can be the entire body shedding like that, or only the palms and soles can happen. So it can be localized or it can be generalized. Most of the times, this peeling happens without any itching, irritation or redness of skin. So that is still fine. You can just apply moisture and you can control it. But sometimes there is some amount of inflammation in the skin, means there is some amount of redness or some type of soreness or some type of burning sensation. Then it needs a little bit of extra care. Whenever it is localized, like restricted to palms and soles around small part, handling it is much more easy. Whatever said and done, since it is a genetically driven condition, that's the way the skin is shedding, there is no permanent solution for this. So there is no treatment, magical treatment which can remove this condition permanently. But you can maintain them. So by applying moisturizer regularly, keeping the skin soft, the peeling whatever is seen will be less visible. So that is how we treat this condition. Rarely this condition can also be associated with some other internal inflammations. See, sometimes people can have a raised IgE levels where they are prone for a lot of allergy reactions. Sometimes in conditions like Netherton syndrome, people have a very fragile hairs and the hairs tend to break off. So there are some associations of internal conditions as well. So any peeling skin syndrome, or you see excessive peeling of skin, get it checked with a dermatologist so that you can know like what's happening inside the body and on the skin. And how do we manage this? Since the skin is becoming dry and it is peeling off, so the moment you put moisturizers, it gets better. So the best thing is to apply liberally coconut oil before taking bath, massage nicely and take bath. While taking bath, use a lukewarm water. Don't use very hot water because hot water removes all the moisturizers. And when you are taking bath, use a mild body wash, something which has a lot of hydration properties. And after bath, dab it dry and immediately put lots of moisturizer. And you can always repeat moisturizer. See, applying moisturizer is just like how we satisfy ourselves when we are thirsty. So till the time our thirst comes down, we keep drinking water. The same way, so whenever the skin is dry, please apply moisturizer repeatedly. Probably for a month or two, you may have to apply 8 to 10 times in a day, but that's fine. Once the skin settles down, you can apply only once or twice and that keeps your skin hydrated. And the other thing is protection. Whenever you are traveling, whenever there is wind and sun, the skin becomes dry. So protect yourself with full arm clothes. If you are driving for long distances, wear a glove so that prevents your skin damage even from UV rays. By doing this, you can definitely maintain your skin. Another one simple thing which you can take care by nutrition is your increased intake of omega-3. Omega-3 helps to maintain the lipid barrier in the skin. And foods which are rich in omega-3 are one, the non-vegetarian source is the sea fish. The vegetarian source are the algae-based extracts. Walnut, flax seeds are rich in omega-3. By consuming this, it definitely adds on to the whatever topical treatment you are doing. So peeling skin syndrome is not a very great or a very horrible skin condition. It can be controlled, but it needs a sustained care. Thank you.